Welcome to Stop Grammar Time. So, I guess it's time we do a Guam update.
Yep.
Let's do a Guam update. Kathryn, what are we supposed to be doing in about 12 hours?
We should be taking off on our first leg of the journey. Um, Flight out of Wichita Falls.
But we're not going to do that. Sorry. So, here's what we did do in the past 36, 72 hours.
Well, about 4 days.
Yeah, about 4 days. Let's go with that. Let's rewind. What happened?
Let's rewind way back to February. So in February, I was sitting at a chair at the desk at my job, and I turned my head to the side and popped my neck and felt like lightning went down my right arm, and thought I pulled a muscle in my neck, and looked up ways to help a pulled muscle. And so for about the first month after that problem, that issue, I didn't seek any medical care. I did see a chiropractor probably about 3 weeks in. And at mid-March, I went and saw a provider on the base at the clinic because I started experiencing numbness in my right hand. I was having issues with my nerve in my elbow, and the provider told me, and this is a direct quote, "You have two separate issues. You have a pulled muscle, strained muscle in your neck, and you've aggravated these nerves. You have tennis elbow and golfer's elbow, and that's what's causing the numbness in your hand. Here's some exercises," because we were leaving, and he's like, "Don't really need physical therapy for this." So it didn't get better. And I went back in April, and that provider said, "Here's some pain meds, anti-inflammatory, and we'll try physical therapy." And at this point, I had been seeing the chiropractor for almost 2 months, month and a half, somewhere in there.
And we were paying them out of pocket because the military doesn't pay for that.
Care doesn't cover that.
No.
And so he said, "You're not getting any relief." He said, I really think that you need to start pushing for
imaging.
Because no one had done any imaging at all.
And it's what they do. They go ahead and try and do the cheapest thing first,
which is physical therapy,
and throw drugs at you.
Ibuprofen 800.
It's common.
That's candy. So this is normal for TRICARE. Very normal. And so I mentioned that to the, by the way, my chiropractor did traction on my neck. And I had about 24 hours of relief in my arm with no medication, which was fantastic. So I mentioned it to the physical therapist, and he said, "Okay, we're going to continue traction." So they did traction on my neck. I did 9 visits of traction. And then the week of the end of May, so I guess May 21st,
sure,
was when they packed up our house. And like for a week, I was busy getting everything ready. And
because I was still working at that time,
I angered my arm so bad that I was taking 4,000 milligrams of Tylenol a day and was still at a 5 and a 6. And this bicep muscle in my arm was so tense that I couldn't straighten my arm all the way. And I called the clinic on Monday, May 24th, and I said, "I don't know what to do. Physical therapy is not helping. I'm in so much pain." And the nurse advised, they called me back a few hours later, and the second provider that I saw said, "Well, we're going to just order more physical therapy." And I was like, "No, you don't understand. I am taking 4,000 milligrams of Tylenol a day. And I can't live like this. My husband is ready to take me to the emergency room because I can't straighten my arm. And she goes, "Can you be here at 2 o'clock tomorrow?" Yeah, I can. So I saw a different provider, a third provider. Um, First time I saw an actual doctor. And she did an exam, and I broke down in tears because I couldn't move my arm.
So, long story short on that
Anyway, she finally put in
one.
imaging.
So, Kathryn got an x ray right away.
I got it in June, beginning of June.
Mm-hmm.
We were leaving on vacation. Anyway,
So, we wanted to get it done as soon as possible.
They did the X-ray and found some arthritis in my shoulder, but nothing significant bone-wise. And then they did the MRI. Got scheduled for the 17th of June, which was right before we left. Not a big deal. Get the MRI done and then continue treatment in Guam. That was the plan. Well, they called me the morning of the 17th of June. The air conditioning unit had gone out in the MRI trailer, and it was like a hot box. It's Texas. It's hot. And so they rescheduled it. Originally they were like, "Hey, we're going to reschedule you in July." And I was like, "No, I'm leaving. Like, you got to do me before then. Like, it's got to happen." They're like, "Okay, how about June 24th?" Okay, cool. 7:45. I'll take it. I will be there. Thank you. So
Here's where it gets interesting.
Thursday, June 24th. By 8:50 in the morning, I was done with the MRI. And by noon, I had a referral to see a neurosurgeon because my spinal cord is being compressed by a large bulge between my C5 and C6. I've never seen a referral go through that fast.
In fact, Kathryn got a call from the neurosurgeon's office saying, "Hey, there's an error on your referral." And she's like, "I don't have a referral. You guys have the wrong person." "No, you're Kathryn. No, this is your referral. You need to get it fixed because it's the wrong tax ID code."
Yeah.
And she had no idea what was going on and finally got off the phone with them. And the clinic calls 5 minutes later saying, "Oh, hey, just to let you know, you had this large bulge in your C5, C6.
I was in Whataburger at the time, FYI.
Better than In-N-Out, that's for sure.
So I call the neurosurgeon. I get everything fixed through referral management. Shout out to the ladies in referral management because you got it done.
Thank you.
And
called up to the neurosurgeon to get an appointment.
They had an appointment and they were like, "Well, we have to have proof that your referral has been fixed." And so I was on my way to referral management to get a printout of it because I don't have a printer. All of our crap is headed to Guam.
Mm-hmm.
And the neurosurgeon called me and they're like, "Hey, we've got it. We can see you tomorrow at 9. What? What do you mean you can?
Yes, give us the appointment, please.
The next day? So the morning of the 25th, which was Friday, I went and saw the neurosurgeon and he showed me my MRI, and your spinal cord should be kind of like oval, egg-shaped, and mine is pushed in because the bulge in my neck is so bad. And he said, "You need to have surgery immediately." And I was like, "Well, we're supposed to move to Guam in 4 days." And he's like, "You need to see a neurosurgeon there." I was like, No, let's do this now. There's only one neurosurgeon on Guam. I don't know if he accepts TRICARE. I don't know how good he is. Let's do this now. And so he said, "Well, you have to have approval through TRICARE and all this jazz." And
yeah, we can do that.
They scheduled me for Wednesday the 30th, literally the day that we're supposed to leave. So in 12 hours, we should be getting on a plane and headed on our next adventure. And instead, I have having a surgery on my spine.
Yay!
Um, Also, shout out to the patient advocate.
Yes, very much
At the
so.
base, I went in and sat down and explained all of this to her, and she goes, "Let's get this surgery approved.
Hmm.
That's first."
So
And
that was
so
like 2 o'clock in the afternoon. We went
I
down.
saw her at 2:40, y'all. I saw her at 2:40, and she called me at 3:17 p.m. on Friday and said, "You're approved."
Yep,
Um,
that was amazing. So thank you.
it's been an emotional few days.
Oh, and plus the doctor said, "Hey, what medications are you taking?" And she lists off,
Oh,
oh, Tylenol and this other muscle relaxer that helps take some of the pain off. And he's like, "Oh, you need to stop taking that muscle relaxer because it thins your blood, and we don't want that before surgery."
that's a good call. Thank you for that.
Yeah, appreciate that.
Haven't had pain meds since then because there was an issue with the electronic prescription service. So that
Hmm.
was been it's been intense.
So it needed to be sent to the Walgreens just down the block, and they couldn't receive it. And
Cause
this doctor's office only does electronic
it's fine.
requests.
I got some today. It's fine.
Yeah. So 4 days straight, and she's like, I'm dying here. This sucks. I'm dying."
It's fine.
Yeah.
I'm fine. Everything's fine. Um, so tomorrow morning, I'm going in, and they are going to go in the front of my neck and um, push my esophagus out of the way and remove the bad portion of the disc or the whole disc. I have no idea.
Yeah. It depends.
And put in spacers. So
Not not fusing
they're
together.
not fusing it. They're putting in spacers. I'm pretty positive that this is actually from a CrossFit injury. Um,
That's why I don't do CrossFit.
but I don't know. Obviously never had any imaging done from that injury.
Yep.
So,
So we don't know exactly.
um,
Could have been anything. It could have been when you fell down the stairs with a tray of, what was it, brownies?
just brownies.
Yeah.
Um,
Sprained her ankle, but
oh, I did. Yeah,
yeah.
that was bad. I have skills.
Yeah.
So,
Yeah.
wanted to update you guys.
So we're gonna try and leave the end of July. So
We've got tickets scheduled again.
yeah.
Um,
My sponsor has actually got us a house on the base.
that's exciting.
So hopefully we can keep that. They don't like shove it off to somebody else first, but
If
he said we might be able to keep it.
it is what it is on the housing
So
thing,
fingers crossed.
it'll be fine. I
More than anything, I want Kathryn to not be in pain and be able to feel her hand.
It would be so cool to feel my thumb again, y'all. I've not felt my thumb since probably about mid March, and then this side of my finger is just straight like tingles. This side I can feel.
Weird.
So
But yeah, more than anything, we just want to give you an update, let you know what's going on. I know a lot of people have asked, like, "Hey, when are you leaving? Are you gone yet? What's going on?"
I know.
And
Somebody saw us and they were like, "I thought you already left," and I was like, "Well, about that."
I went into work today and told people like, "Hey, I need to take Kathryn to surgery. I'm gonna be taking care of her. I'm going on permissive TY so I can be here with her, take care of the kids, stuff like that." Um, but I had to tell the story like 5 times, and
It gets shorter and shorter every time he
I'm
told
like,
it.
"Kathryn needs surgery. I'm gonna be gone. Bye." So I want to put it on here so you guys can hear the whole thing and just get all the details.
That's
So
what it is.
yeah,
Tricare is amazing sometimes.
sometimes when you really get on them. So yeah.
But other times it can be very, very frustrating. So,
Yep.
this is going to be a thing. It kind of sucks
Yeah.
being 34 years old and having them.
She got it
I
right.
did. I got my age right, guys. And having to have a pretty big surgery.
Pretty big surgery. It's pretty quick though. That's
Yeah,
the
the
good
doctor
part.
says only like 45 minutes, but the
That's
reason they recommended that we do it ASAP is I've already been through physical therapy and it didn't help. And your spinal cord cannot repair itself. It's not like a liver. The damage that's been done will never be undone.
So hopefully with the surgery, if we get it done quick enough, she might regain her.
I might regain some of the use of my hand
Mhm.
back. Um,
But if we do the surgery, it won't get worse.
it won't get worse.
So
So that's exciting.
that's a plus. So we'll
Um,
go with it. I'm okay.
it's just been
Hectic. Trying to get all this together and
it's been emotional. Um,
so I'm glad we have a great church family, a great work family, friends, family, everybody here. Thank you all for your help, your thoughts and prayers. Just everybody is asking me like, hey, what can we do to help? I don't know. I have nothing I need right now,
we're good
but
for
I
now.
I appreciate you. I really do. So thank you,
It's
everybody.
it's been a lot.
Yeah.
But we are still looking forward to our adventure to Guam.
Hmm.
Um, we do have to do a few more. We have a few more hoops we have to jump through
Hmm.
because um, of any follow up care after the surgery. It has to be approved through EFMP, which, if you don't speak military, that stands for.
Exceptional Family Member Program.
I think so.
It's pretty much if you need special care of
Yes.
any sort, they need to make sure if the next base has it available for you. We're trying to get it as much as possible that she can follow up with her primary care manager and she'll just need physical therapy.
Because I am hoping to regain some of the strength in,
Yep.
especially my right arm. My right arm is much worse, but um, the neurosurgeon was like, "No, you have bilateral weakness in your arms." So
Yeah.
didn't realize my left arm was also struggling.
Yeah.
It's y'all. It's been a hot 4 days.
Yeah.
It's been intense. I guess it's 5 days because today's the 29th.
Yeah. Sure.
But
We'll go with it.
yep.
Okay. So cool. All right. Well, we're gonna end it there because along with Kathryn's weakness in her arm, my arm's starting to get a little shaky too from holding this phone up.
I can't even hold the phone up,
Yeah.
guys. I can't record anything right now.
Yeah. So it's all me.
Yep.
All right. Well,
Thanks for watching. We will update you guys at some point again. Um,
yeah.
just thank you again for all of your prayers and positive vibes, good thoughts. I will take them tomorrow.
Yes.
Yes.
So wish us luck. We shouldn't need it, but hopefully we get this surgery done early because it's a first come first serve kind of basis. But
I know they gave me a time. They're like, your surgery's at 1 o'clock, but if you show up at 6
show up at
a.m.
6.
and nobody else has shown up for their time, we'll put you in. And I'm like,
Okay.
that's a really weird surgery thing, but I'll show up at 6 a.m.
no
if
kidding.
it means you're going to get my surgery done.
Yep.
Cool.
So we got to do a little fasting. So I'm going to get her a snack tonight.
It's going to be fine.
We'll be fine.
It will.
So
Anyway, thanks, guys. Bye.